Thanks, everybody, for coming. I will try to keep this as brief and to the point as possible, because I know you're all busy and we have things to do. I apologize for making you all come into this meeting room. Now, we are under the recommended 50 as far as a meeting, but I do think it's important that we maintain our good social distance and that type of thing. But we thought for this meeting it would be important that we meet face to face and start this conversation, as we enter this new phase of this virus. First of all, let me say thank you for all you're doing and your patience. As leaders, you will be the people who set the tone and direction with your employees. We can read all the stuff on the newspaper, we can see it all on TV, but what really matters is what they hear from you, okay? What we're trying to do here is to reassure you, and I think one of the things that I think some of you are aware and others aren't is that since this event has kind of gotten legs, the senior management, the emergency management with Lisa McMahon, as well as the public health department, has been meeting on a regular basis to say, how do we handle this? How do we sort through all this massive amount of information and make good policy based on that? And while we've implemented some policies, we probably haven't done a very good job of communicating everything we're doing. Even though information is out there, there's a lot out there. And I know on our website, we have a link that goes to the public health webpage that has a vast array of information that's coming out. Tried to send out a memo last week. I think you all got that. We'll be doing another one today. And so the purpose of today with you is to share with you some of the key topics that we are going through and what we're going to be asking our folks to do and how we think they can be as safe and effective as possible while still maintaining their services to the public. What I will say in general, we'll have different people and experts come up and talk about different subjects. We won't have the answers to all of your questions now. We just won't. Things are changing at such a rapid pace that we're focusing on the here and now, and then we're setting up contingencies for the future. We're better with the here and now than we are with the future. We'll be meeting later today talking about what ifs and so on. So we're taking what we have today and going to talk to you about how we're going to work through some of these challenges, how we can address the needs of our employees, because I know they have questions. What I will say, and I looked at this from a big picture, and you look at what the federal government is doing. They're setting legislation, or they're working with the CDC, and then the states are making policies and decisions. But you'll notice that not a lot of specifics are coming down to the localities. And that's because we know our area better than everybody, or anybody. And so we are tasked with working through the information and providing good choices for our people. We may get mandates from the federal government, we may get mandates from the state, but much of this is being left up to our public health officials and our emergency services and our counties and local municipalities. So we have to kind of be working together and making sure that we're focused on what needs to be done. I thought what I would do is ask some people to come up and talk about various aspects that may be of importance to you. We can take a few questions. Again, I apologize, we won't have all the answers because there are a million questions out there. First, we're going to talk about the communication process that's been set up and how we're monitoring the situation. I've asked Lisa. Well, first, let me start with Brian, if you don't mind. Brian, maybe you can give us a quick update in terms of statistics.
So there's some things going on. Currently, Wisconsin right now reports 33 cases. Polk County, there is no confirmed cases in Polk County at this time. You've probably heard the term PUIs, that stands for persons under investigation. We do have some of those. That's not atypical. Most counties have those. So partners has been good. Probably the biggest area of confusion right now is around daycares. Okay, so the schools are feeling pretty comfortable about kind of where they're going and things like that. I've talked with all the superintendents and they have plans in place. The daycare guidance has been a little bit sketchy, so we're asking for clarification on that. But CDC is encouraging daycares to remain open if at all possible. There's the ripple effect of closing daycares and not having daycare. Families, need to stay home and things like that. So that's one of the determining factors in that.
Brian?
Yeah.
I sent out to some managers, there was emergency rule yesterday from Governor Evers about daycares, and a number of requirements under licensure have been suspended. And so that publication is out, and daycares already have received that hopefully this morning.
Okay.
So as far as capacity and that sort of thing, they're going to be able to go over their numbers and do that sort of thing for a period of time.
Sure, and I think that'll be out of necessity. The schools were confused because there was a little bit of confusion around, is Head Start and 4K, is that considered daycare or is that considered school? Okay, so we think we have the answer to that. They're really falling under the criteria of school policy. So at least through CISA 11, which is this area, the decision around Head Starts is they're going to comply with the school rules, so they'll be closing as well. Obviously, as Vince mentioned, things change quickly. We have morning briefings from the state, afternoon briefings from the state, and we'll get that information out just as soon as we possibly can once we get that new information. So I'll be the first to acknowledge that, guidance changes and information changes very quickly, and that's just because it's an evolving situation right now. So, anybody have any questions? Public health has been in kind of ICS response. This is going on our second week, and we've wrapped it into the county ICS structure that at least is going to be talking about just last week.
Question about the daycare. So the daycares that are connected to the schools, are they closed then?
You're talking just the daycare, not considered 4K or Head Start.
Correct.
The recommendation is for them to stay open,
Okay.
but each school district will make
Sure.
their determination.
Okay, and I do know that that's one is closed, that's affiliated with the school, which is Little Saints. They've already closed.
I think you're gonna see the majority that do, they're gonna err on the side of caution.
Brian, do they have the food plans in place?
Every school district in Polk County has a plan in place to be able to deliver or provide at least breakfast and lunch, whether it be through the backpack programs or they've got it worked out with their food services that all of our districts have that up and ready to go.
I know that some restaurants also have, or cafes, one in Balsam Lake, that they have put out that they will have breakfast and bag lunches. It'll be a surprise, they said, because they don't know what they'll have on hand, but it'll be out there for kids.
I would imagine we would start to see more of that.
Sure.
Any other questions or comments? We try to push information. Our first area of information is going to be the Public Health Department Facebook page, and everything then can kind of feed off of that. But that's our primary for updated information. Thanks. Lisa?
All right. I want to make sure everybody has a broad overview of all the different levels of management that are going on, so you're aware of all the meetings and everything that's happening, who's doing what. So to manage the entire incident, there's a lot of different levels, and the Incident Command System, or ICS, is a structure that we use that's both federally mandated and consistent across the country. So we've implemented that, which is blending countywide with public health. So public health and all their operations have moved under a countywide incident command system so that we're managing things consistently with one voice for the county. There's also, of course, just regular government operations. So we want to make sure that that continues to happen outside of the incident management. So what we've done is set up an incident command structure that includes me and Brian as incident commanders. So we're managing the incident side of things. Then there's a policy group, and the policy group is meeting to make policy decisions for county government. They're not worrying about the outside world right now unless it affects us as what we do every day. So you're gonna be hearing, the rest of this meeting is gonna be about what they've discussed. How we continue operations, how do we notify our staff, things of that nature. They've already been clearly keeping us organized, and that's why we're here today. There's also a group underneath the incident command system that is for public information. So there's a group of individuals, they're public health, emergency management, and county government that are coming together to make sure that we have consistent messaging. So we're spreading the same word to everybody, inside and out. And public health's already been doing a lot of that, communicating with the schools, the healthcare facilities, long-term care. We're now broadening that to include the message to go farther. So press releases should all be consistent countywide, that sort of thing. Our Facebook pages are all gonna say the same message. So we can easily direct the public and our staff, and they will all have the same word. And right now, 211, or there's an 877 number, I didn't write it down, are being used and should be consistent, not only countywide, but also statewide. So that system is being implemented throughout all of Wisconsin. So we're directing people there via our Facebook page, our website, and just on internal messaging. And we also have a local phone number set up for the public who may not feel comfortable calling a random operator they don't know. So we've done a lot of levels of reach out there. And internally, Darlene will probably talk about county employee messaging as a whole nother side of it. Underneath incident management, there's a lot of groups. So finance is there, our admin staff. They're helping to make sure that we're tracking our time appropriately countywide. So any meetings or events that take place or things that happen that are directly related to the management of this incident are being tracked. So if there's any future potential for reimbursement. And Public Health's been doing this all along, and now we're including messaging countywide for employees to track that on their time tracking. And some of you were probably part of the pilot rollout for that. Other operations, so Public Health has their own operations staff that are dealing with management, and also the Sheriff's Office is setting up their own management of the incident for public safety reasons. And Chad and the Sheriff are taking the lead on making sure that our public safety continues to operate at the highest capacity. And then again, outreach to the community and outreach to our staff are top priority here, so that's why we're all here today. Does anybody have questions about the incident management? Mostly, I just want to make sure that you're clear if you or your staff are called in to help with the ICS or the incident command system, that just becomes a priority for them. It's not taking them away from their regular job, but it may partially take them away just to help manage this in the short term. And that's something that will provide all the training necessary, but clearly it's probably something new for most people. Unless you were involved in the storm, you probably aren't familiar with that. Any questions? Okay, Vince, back to you.
Thanks.
Thank you.
You know, one thing I wanted to mention too is, what is our priority? And, you know, us in this room, we are focused on keeping our folks safe, right? We want to do what's right, but yet we also want to serve the public. So keep that in mind. So everything we're doing is kind of that balancing act of how do we keep our employees safe, how do we encourage better safety for the Polk County residents, and then finally, how do we keep providing the necessary services for our county? So we're trying to balance all of these things. The other thing is, you know, if you go out into the community, you kind of get two stories, don't you? You get folks that on one end may think the world is ending, and on the other end you got people that say, boy, you're overreacting. Geez, there's nothing here in this county. This is the government's way of controlling it. You know, so you hear the two extremes, right? I look at it this way. We want to do what's necessary now to stop the massive spread of this virus. We know it's aggressive. We know it can be dangerous for those people at risk. And we want to take some steps now that will stop the spread. And that's what the federal and the state governments are trying to do. If we can stop it from spreading like it did in China or like it's doing in Europe, it's worth a little bit of pain now as opposed to a whole lot of pain later. So we are asking people to make some sacrifice and to deal with some uncomfortable things. But in the end, we're going to try and do this in a way that helps us all. Next up, a person who's been on the front line since the very beginning has been Mo in the Public Works area. He's going to talk a little bit about cleaning and maintenance.
As far as the facilities go, right now what we're doing is maintenance staff has been directed to prioritize cleaning doorknobs, push pulls, counters more throughout the day. So we're extra cleaning on those. We're wiping down the boardrooms. This room was wiped down before we came in here. So we're working hard on this. We have supplies on order. Naturally, we have a lot of stuff on back order. We have sanitizing stations coming also, and hand sanitizer coming more. Rod Polk does have some wipes for each department to utilize on that. Remember, it's for department use only, not to be taken home with the wipes. And they do go a long ways. They're very good on there. You need to wipe them down, leave contact with them. We're working with those. We have another shipment hopefully coming in today of wipes with that, because we have seen some theft already of hand sanitizer being taken out of offices and areas being taken. So be aware of that what's going on with that. As a secondary note, we are sitting okay on toilet paper. We did order ahead of time, so we are sitting okay on that, as long as this doesn't go into a long duration.
But the good stuff stays over at the Justice Center.
The good stuff's
There has been rumors.
There has been rumors. And the only toilet paper that is different is the inmate's toilet paper, just for a note. Otherwise, it's the same toilet paper. Might be a different size roll, but it's the same toilet paper. On that, we are asking though that if you guys have, if anyone in the department has a lot of public contact and you're able to keep your door open versus closed, just to limit people having to touch that doorknob all the time, try to keep your doors open, keep those spaces available. Non-essential meetings have been canceled in our these committee rooms, so those have been canceled also. Also, you know, this is going to be kind of a team effort keeping our work environment safe and clean on this, you know, so watch out for things. Again, we'll have the wipes available. As more come out, we'll get the word out. If you guys need more wipes or sanitary wipes, to get with Rod on those things. So that's kind of where we sit with facilities right now. Yes, so.
Is it any kind of safety hazard to maybe leave the stairwell doors open?
It's, I believe, fire code,
Okay, because I know the downstairs
Is with
ones
that.
are always kept open,
right?
but these are not. You know, you're just
But I'll
talking about
check
leaving
into it.
doors open and not having to grab handles.
Right. It ends up being a fire code, but I'll check into it.
Okay.
Yes.
In terms of visitation rooms down in child protection area, I know public health has their WIC area as well. Will those rooms be additionally cleaned? I know in the past it's kind of been our responsibilities to wipe them down. I'm just wondering if at all possible to be able to have some disinfectants, additional cleaning of those rooms.
Or the WIC ones.
Yeah, anything that's generally cleaned by the janitors, they've been going through and trying to hit it.
And these generally are not, and that's why I'm wondering if we could have that.
We certainly can look at it.
Okay.
And then that's part of the whole wipes
Yep.
also, to hand them out to the supervisors, because if you leave these out, they're gonna walk. So, it's not like Kleenexes where you grab 6 of them at a time to blow your nose. One goes a long ways. Josh Erickson did a kind of a test, and he almost made an entire floor, because the rule of thumb is that if you wipe a handle down or a surface, you wanna have it remain wet after you're done. And he almost made an entire floor of just doing handles with one wipe. So they can go a long ways.
So,
Back to the doors again. To try to leave your office doors open. Do you have any door stops available?
I have a couple.
Because a lot of people, they just automatically shut the door behind them, and that might.
I might have some in my office.
Yeah, I Otherwise, we can have,
Appreciate one if I could get one.
Stop by.
otherwise we can have maintenance staff make some wood wedges. Just so we can go through there,
That,
but
that works.
anything simple will work on that.
Are they cleaning, you mentioned the doorknobs, are they cleaning individual doors or are we responsible for our office doors?
You'd be more responsible for your office doors. We're trying to get all the main
Main
public
doors.
ones, the main ones, and the push plates. Again, utilize, washing your hands, I think most bathrooms you can reach the handle with a piece of paper on the doorknob and still reach the trash with it also. So please don't open the door with paper and let the paper just go all on the floor. But-
Probably the most common question you all are getting is from your staff saying, hey, what are we gonna do if? Or, when should I feel comfortable asking for time off? Or is this gonna be a sick day or whatever? I'm gonna ask Darlene to come up and talk about our policies. Generally, I'll say this. Our HR policies regarding time off and sick leave and for PTO and those things are pretty good and they're pretty standard and I think they're gonna be effective. But what we are doing is making it a priority that we allow you to stay safe and comfortable and you can take care of your families. So we're gonna add some flexibility, but it's gonna depend on your leadership with your staff to make sure that, in the case of working remotely, you're gonna have a little more flexibility. But we still want to be able to provide our services when we can, but we also want to do some things to make you as safe as possible. So, Darlene, do you want to talk about that?
Good morning. Thank you all so much, first of all, for the support you've given your employees, and we ask that you continue to do that. They've all got some big challenges ahead of themselves, just as you do, with the schools closing and a little bit of the fear, and we want to try to keep the fear at bay and really focus on how do we continue moving forward. I did send out a code red test this morning, so it went to everyone that we have in the system. So please talk with your staff and your teams when you get back, see if they've gotten it. If they haven't, let's look at what we've got for contact information, so we have that for them. We are really putting a lot of challenge on each of you. You know what your department needs to do. You know what by statute is necessary, what the primary concerns are, how you can best handle things. So we are asking you to be as flexible as possible with your employees. It may mean thinking outside of the box. If there's employees that could maybe work a later shift, could we make that work? Could they maybe stagger with other employees you have so that they're working together with their daycare issues or different issues that they have with childcare? But we're really asking you as management to really look at your departments, your needs, your team's need. How do we balance everything? So we fortunately do have a remote work policy out there that community services uses. Is it perfect for them? Yes. For you, maybe or maybe not. So after this meeting, I'm gonna send it to everybody. You can look at it. Some departments, it won't even be an option. I looked it back to see Jill Stoffel. Her team, unfortunately, just cannot work remotely. But others, there's a good opportunity. Maybe some of their work at least could be done remotely. So I'm gonna send you that policy. If you wanna work with our office, we'll help you make it so that it fits you and your needs. IT will be struggling to help you as best they can. Again, we do have limited tools, so we're gonna all work together on this and just stay focused on solutions and how can we work forward. We did send out a frequently asked questions to everyone that includes some of the how do we handle different things. All of this went out before the school closings, so we weren't aware of that at that time. We also included in there some language about possibly negative PTO balances. The feds are now working on some different options for us. So we do need to be really fluid with this. I can't tell you right now exactly what it's gonna look like by next week, but just know we are working and we'll work with you completely and totally. How can we help you and your teams? So currently, we're asking for folks to eliminate as many unnecessary meetings as possible. That includes potlucks and fun things like that. Being aware of all that though too, remember there is a EAP, the Employee Assistance Program. A lot of our employees may start struggling a bit if they do have to be isolated at home or their family members are. Again, be mindful of the whole employee. So our office, again, will be sending out to you the current remote work policy, and we'll be asking you to really look at what will work for your team and your department, and we'll keep working with you as we learn more about what the feds are gonna do with the time off policies, how it can incorporate with us. Bottom line though, when you have employees that need to be off because of COVID-19, please let our department know. We'll get them out the FMLA paperwork they need. We'll support them as much as we can, and we'll be tracking all of that as well. Any questions right now? Yeah.
Guidance-wise, with the 14 days that the federal government is offering, just as a policy, what is Polk County implementing? They take their own PTO first, they get to use the 14 days associated with this government policy first. Any guidance on that?
Perfect.
Maybe you'll be sending that out.
Thanks, Mark. Mark asked if, what do we do for someone that is asked to self-quarantine or are told they have to be under quarantine? Currently, that's 14 days is what, correct, Brian? That hasn't changed. So it's currently 14 days for self-quarantine. If that occurs, even the public health department can write something up for us that just says, Darlene Kuzmarek has been asked to self-quarantine. That will count for your medical documentation. It goes right into FMLA. So it would be 3 PTO days if you want to use accruals, and then could go into that extended leave bank. We will be making exceptions for employees that have been here less than a year, even though they may not qualify under FMLA guidelines. We'll be working with them and making sure that we're going to do our best to keep them whole. Does that help?
Currently, the federal government has not passed any legislation related to it.
Correct. The feds are still working on the legislation. They have got a lot of great ideas that would be very supportive of employees, but we have to wait until that passes before we don't want to, it's kind of the chicken or the egg, and we're trying to figure out what to do first. So for now, we're gonna follow our policy as is, which would be 3 PTO days and then extended leave, or for those few that have the extended sick banks, they could go to those. But we will be working, as soon as we learn more about what the feds pass, we'll work with it to make sure it fits our employees. Yes, Sally?
So I have an employee in my office who now is a 6-year-old out of school, is possibly not gonna have daycare. She doesn't even have 3 days of PTO. I mean, she's very new. What do we do with her?
Oh, thank you, Malia.
With the pending federal legislation, one version passed the House. The Senate probably is not going to take it up until later this week or early next week. If we make a decision today to say, okay, well, anybody in those circumstances could go into negative PTO balance, we might not be able to then take advantage of what the legislation is. That's why we have to hold off right now, because we want to make sure that employees have the best options. So if that legislation were to pass and go into place, hopefully then we could backfill with those 14 days that are at least in the House bill. So that's kind of what we're looking at. But if we allowed folks to go into negative PTO, they would never reach that point where they would be eligible for the 14 days that the federal legislation could give. So that's why we have to just at this point maintain status quo. It might, for a short period of time, have some paychecks be lower, but the hope is then that we will be able to backfill with the days. And that's the best answer that we have at this point. But we are aware that there are certain folks that have that limited situation, and we want to do whatever we can to make sure that they're not negatively financially impacted, and that's why we're holding on.
And if I can just add to that, if you're thinking, well, gee, why don't they just do that and figure that, by making someone negative PTO would be hard on an individual. I can't imagine knowing I've got to work for 6-9 months to catch up on my PTO, just to be even again. And so if we have to, we'll open up the negative PTO, but we're hopeful that the feds will come through with something that will be even better. So we want our employees to get whatever's best for them. In the meantime, school closure doesn't typically fall under FMLA, so currently we're really asking and challenging you if you can be flexible. Are there ways that they could work different hours, different shifts? Are there other things that could be done? In the meantime, keep in mind payroll won't be complete this pay until the end of this pay period, and then we'll be working through that. Our employees do get up to 5 LOA days. I know they're not paid, but they do continue to get accruals and maintain their benefit status. Any other questions for now? Thank you, Willie.
One of the things that Mr. Loso just brought up is that this next cycle of Kronos doesn't close until Monday. So hopefully, we may have the answer if the legislation goes through the Senate. The other thing to keep in mind also, as far as the FMLA and the school closures, the version of the bill that passed the House does incorporate school closures and need to stay home and take care of kids that are not allowed to go to school as a part of FMLA. So if it passes in that version, it would open that up automatically for us.
Thank you. I neglected to add that is currently in the bill that's being reviewed. Thank you very much.
Charlie, I would just mention too, there's a lot of, high schoolers are out of school, college students. I know some schools are even putting together resources for families, people that may be willing or wanting to do childcare. So encourage your employees to be creative too.
Thank you. Did everyone hear Dana? She had mentioned that be mindful that there are a lot of neighborhood high school kids looking for something to do now that the school is closed. Perhaps daycare or small, they could maintain in folks' homes. So really ask your employees to consider that as well. And you said there's some lists available?
I know Anne Marie is putting something together just for like the childcare families that are affected, because we use the daycare in the school. So
I'll say we're doing the same thing, asking high schoolers that can babysit to sign up and have a registry list and all that.
even college students too, that are, if you're more comfortable with that. But yeah, there's going to be some good options out there.
Perfect, thank you. And talk to each other, obviously. Thank you.
Mr. Lasso is expecting his first in a couple of weeks. He may need some practice providing daycare. Maybe give him a call for an evening shift or so. All right. Flexibility is key. The legislation is coming down. We may get more announcements from the president, from the governor. You read about these things all around the country, and some things may be coming down to us. So our key is to be flexible. I don't know what's worse, but sometimes I think if you send out a message today, then you change it later in the day, or you change it the next day, then it changes again. It creates confusion. And so what we're going to try and do is set out a timing or a process where we're going to get information out to you on a regular basis, or maybe it'll be on our website, but we'll try to keep that out so that you'll have one source of information that will give you the latest that we have. Next, we have county business to do, and people have meetings, we have travel plans, but we have kind of changed our approach to that, and Tanya, I've asked to give us an update.
Okay, so for travel and social distancing, so right now what we're asking for work-related travel is that it's business related to statutory purposes. So we're looking at enforcement, licensing, investigation, response, maintenance, or monitoring. Contact with the public should be kept at a minimum when at all possible. Travel should be rescheduled. All travel outside Polk County requires prior approval from your respective division heads. So community services, public works, environmental services, law enforcement, and general government. And right now, I think a lot of stuff is just being canceled. Trainings, we're getting a lot of training cancellations. But like Vince said, we still have that essential business that we need to do. So personal travel is not being addressed, but, you know, if we're listening to the government and president and all of the officials, we just want to minimize our travel to keeping it, stay home when you can, and travel to low-risk areas if you do have to go out. Hopefully you did buy toilet paper when it was still on the shelves. So when, as far as social media or social distancing is concerned, when the contact with public is necessary, we want to do that 6-foot distance when possible. No shaking hands with public or each other. Pretty common sense stuff. So for positions that require physical contact, thinking of law enforcement, if they do have to arrest somebody or come into that within the 6 feet, we have public exposure kits that we've ordered. I believe they'll be in this week. We are also ordering a backfill of them because they're only good for one-time use. And with that doesn't mean that we expect law enforcement to have their kits on all the time. It's only if they happen to pull somebody over and they're going to need to make an arrest, so they're going to want to run back and put their kit on if the person is coughing and displaying symptoms. And we'll replace those. You can contact Kathy Gingras. She's the logistics officer for the incident command, so she'll be heading all of that up. And like I said, we ordered extra because we do have field-based staff who could come into contact, so we want to make sure that we're keeping people safe. Brian, do you have anything to add on that piece of it? Okay. Any questions?
Tanya, could we have one of the meeting rooms maybe set up instead of using the intake room? For that intake room for ES is so small that there isn't 6 feet in between nobody.
Okay, yep, so the question was,
Like a room set up?
yep, so we have some pretty small meeting rooms in here that we expect our workers to be meeting with the public in. We'll shut those down and get them into a bigger area. Ron?
Is there any like specific guidance for when staff are supposed to be wearing the suits or the equipment?
So he's wondering about guidance for when the staff are supposed to wear the suits?
We've sent out the law enforcement guidance that
Kids.
addresses that. The law enforcement guidance, everybody was sent, explains to law enforcement when to apply the suits. And then also within our Lexipol, there's the communicable disease policy. So, but in the guidance that was sent out to deputies and separate corrections, Monday or Tuesday, that guidance says when the equipment is on.
So with our child welfare workers and crisis workers, we want to make sure they have the kits too, because they're going right into the homes and picking up kids.
So will that guidance be coming for us too, or the workers to put one of those suits on if we're holding babies and kids?
Yep,
So guidance will be.
yes, if they're symptomatic. You don't have to put on your hazmat suit to go into the house, but if they're symptomatic, you want to be aware of that and put it on. Any other questions? And if anything comes up, just email, Vince, do we have a general email that we want them using if there's questions?
Work-related, county?
Yeah,
Specific, we'll put that in.
okay. And there is a memo coming out later on this afternoon with all of this stuff that we've talked about, so that'll be in there if something comes up. But in the meantime, you can contact me and I'll get you the answer.
Yeah, there will be a summary email that will come out to you and to all employees this afternoon, which talks about some of these things. And we'll have some resources like phone numbers or emails and so on for clarification. It's hard to say, but in one sense, we're somewhat lucky that we have experience with emergencies. As of last summer, we had the storms, and as terrible as they were, we learned a lot. With Lisa and Chad, we've put together, I think, some improved processes to help us in any type of emergency. I've asked Chad to come up and talk about the overall contingency plan we have and how we address them, and what functions we have out there that are making that happen.
So I I think Vince might have covered the structure of the committee, but I came in a second or two late. So there is a policy committee that's led by the administrator that has the chairman of the board, corporation counsel, the sheriff, the ESD director, the CSD director, the highway commissioner, myself on that. And that is to deal with the continuity of operations. You know, how do we continue doing what we do? What policies do we need to adjust? It's a fluid situation. You know, how do we continue providing the most services possible to the public? Where we come into the administrators, we give advice and status updates on how our operations are going, what we think needs to scale back, those kinds of things. Where the managers help the directors is in the continuity planning. And what I mean by that is, for example, I sent a memo to Captain Drew, Captain Hall, Jill Stoffel, and Lisa McMahon with specific issues I wanted addressed in planning. And I've approached it in 3 stages. We have no cases. The sheriff's directive is we continue to provide services at the full extent with no cases. So right now, we've made preparations, we've put protective measures in place for employees, we've done education for employees, we're ordering the PPEs for employees. That's our contingency now. Now with schools closing, I've got them writing up contingency plans for me. How will you deal with that staffing wise? Who are your susceptible employees that have to be off? How will you backfill, knowing that we have to maintain this level of service? The next one would be nominal cases of COVID-19 in Polk County. I define nominal for my staff from 1 to 10 cases. How will that affect the sheriff's office? How will that affect operations? What are your plans for operations in your division? And write those up for me. And then the last case was widespread. You know, if we have widespread COVID-19, how's that going to affect your operations? How will that impact? How will you staff? What services will you have to scale back? The last piece for law enforcement specific to us that doesn't involve really anybody else is civil unrest related to if we go to a national lockdown and restaurants close and all that with the call surge, how do we deal with it? And that's for us to do the planning on. What's important for the department managers to do is and it really needs to be written for the directors because we need to be able to do a written contingency plan, whatever levels your directors set it at. We need to be able to look at and do overall planning, and then those of us that answer to 2 masters, elected officials and the administrator, need to be able to show this is where we are, this is your expectation, this is what we can provide, this is why we can't do this is why we need to shut this down, those kind of things. Because the questions will come from employees and from the public, is the county shutting down, are we shutting down this department? We need to shut down this department because they don't have staff. Well, what if we have staff in environmental services, administrative staff, that could help in community services? That's where contingency planning comes in. And we can't give good advice to the administrator or our elected officials if we don't have good plans. So that's what we're all about, is planning it out, you know, the what-if scenarios, and we hope those don't come to pass, but that's what we should do. And I think we're on pretty good course. You know, I imagine you'll see things come down from your directors about, you know, how do you plan on this impacting you and what are your responses? The other thing is we are constantly planning on the policy changes. Does the current HR policy apply to this situation, or do we need to adjust? When legislation comes out, do we need to adjust policy? And that's what that group does, is discuss all the changes. So far it's worked pretty well. We've met at 8 and 3:30 every day. We had a conference call on Saturday. Vince gave several of us homework over the weekend we had to do. You know, the sheriff gave me homework I had to do. It's just, but you know, we're doing a lot of behind-the-scenes planning. You know, like Vince put in, it's a pretty good analogy. It's like a duck on water. You don't see the legs underneath paddling like hell, but you see the duck just floating across the water. And that's what we want for the county services. Any questions on that? As far as what your individual divisions expect in the form of a contingency plan, that's to your directors. I'm just kind of giving an example of what I've asked of my people.
Well, sorry, I got too much joke. To that point, you know, the things that the directors have been bringing up to me, and I would say to you, in this contingency planning, as you put this together, think about things like, if this building shut down and people were working from home, or maybe it doesn't get shut down, but more people work from home, are there any essential jobs where they need different communication? You know, like maybe they don't have a cell phone, maybe they need a VPN available to them so that they can access files and that type of thing. What we would need, and as what you would tell your director is, you know, how many people may be going home because of childcare during this school shutdown, and how many phones or how many VPNs need to be set up. That's the kind of stuff that they will then pass on to me. And again, in the spirit of doing what's right to keep people safe, we're going to err on flexibility. We can't always do, you know, I'm sure there are some great things we would like to do, but quite frankly, we're not at the position where we can do, you know, buy everybody, you know, new things. But we are going to see what we can do in terms of easing restrictions on getting access and communication. Speaking of communication, it is challenging sometimes in a situation like this because we hear information, we say things, and next thing you know, it's going out and the messages get garbled, or we have different messages going out to different organizations, people, and it creates chaos. It creates fear. It makes people think, geez, we don't know what's happening. We don't know what we're doing. And so we do have a line of communication set up, a process of how information should flow. And then also we have a directive regarding requests or information or questions from the public as well as the media. So it's very important that we follow those. And I think, Darlene, you were going to address that, or was it Lisa?
I'll make sure that the message gets in for you, Darlene, to share with the staff.
So,
Well, yeah.
you want me just to?
Sure.
Oh, okay. Sure.
We will have two different avenues for communication. One will be from an employee point of view as an employer, as Polk County being the employer, and those can come to me, and we will be tracking any hours that are used for COVID-19, so sorry. We will be tracking any absences associated with it, as well as any hours that are used for them managing and anticipating of how do we serve. So we're tracking those. So along in the email I'm sending all of you, it's going to have telecommuting. It's going to have also how to track those hours. And then also if any of your employees feel like they have been directly exposed, obviously throughout the workday, their first track is always self-care, always to talk with public health or their medical provider, but also then follow up with their manager. So because we will file that, we'll note that right away that there's been an incident. As far as the real heavy communication, that will be coming, and I'll let Lisa address that.
So messaging that we're going to put out to the public is all going to go through the incident command system and the public information office. So if the media calls an employee, they should not respond directly to the newspaper or TV reporter who's asking questions. That needs to go back through the incident command system, through the public information function, and then that can go back out to the media, and generally through only one point of contact. So we're working on making that system a little bit more robust, and the email address we'll have for general questions will be in the message that Darlene will send out to all staff. There'll be a general phone number, there'll be website links for all staff to look at to get the most up-to-date information, and we'll also have one point of contact that can be reached 24/7 to help staff address any of those type of media inquiries or requests for information, to make sure that we're putting out the latest messages from public health and we're not saying anything inconsistent. So right now we're working on bringing some staff countywide, including public health and outside of public health, together to form this public information office under one umbrella. So the point of contact will be sent out in that message through Darlene for who to reach out to.
Okay, that's kind of the 6 or 7 subjects that we wanted to address. Are there other questions that need to be answered here?
So if the federal government does declare a national lockdown, do we have, like, obviously the sheriff's department, public health, child protective services are essential functions. Do we have a plan for what is considered an essential function and what is not? And do we have any plan?
Correct. We do have, I think, in each division, each director has the idea of what are the essential functions. A lot will depend on what the federal government says and what they mean by a shutdown. And does it apply to government entities? You know, if you've seen so far, these states are shutting down restaurants and bars. They haven't, and schools, but they're not shutting down government institutions.
Courts are shutting down.
Pardon?
Courts are shutting down.
I just saw the Supreme Court was.
And New York City's courts and other courts now.
Right. So we will address those as we go. At this point, in fact, this afternoon, our topic of discussion are those types of contingency plans. But until we see, you know, what in fact is coming down, we'll prepare for it the best we can. What I would say is that as leaders, your job is to make sure that your folks are comfortable with the fact that we're going to do what's right for them. It may not be what they want every time, but it's going to be something that's going to say, we're thinking about your safety. Now, not everybody is, you know, has, as we said, PTO times and those types of things. We are going to make some adjustments and flexible things that we can help them. But this policy committee, along with public health and emergency services, will be addressing those things.
And then my other thing is that most employees can't get on Facebook on county computers. And if that's our main source of information to public health, would that be a method of something that we could open up at least for this period?
It's an RSS feed up to the county website, so they can get on through the county website.
Okay.
Right. Yeah, and again, you know, and I can say if anything good comes out of this is the way we handle communication in the future, because having a public information officer or PR person would be very important. Having one network of social media and a website will be key. But right now, you can go to the Polk County website, and it will direct you, when you click on it, to public health.
And I've been there, when you said it was the main method of Facebook, I didn't know if it was going to be on everything at the same time.
They're contingent, or they're together.
Okay. I ask that you all proactively speak to the people that work with you and address some of their questions. Feed those questions back up to your directors so that they can filter in and we can address them with the committees that we have set up. We are going to work through this together. I'm very confident that we are in a good place, but we have to take it very seriously. And we wanted to present that front to our public that we are doing our jobs, but yet we also know that under unusual circumstances, we may have to take some unusual steps on occasion.
So my department, we serve the population that's highest at risk.
Mm-hmm.
Should I be taking action as far as, you know, doing things or canceling non-essential one-on-one appointments with those veterans? I mean, should I be putting those measures in place already?
Yeah, and I think, you know, Brian is a great source for that because there are recommendations. When you, with the term non-essential, that might be highly recommended. It's not, you know, it doesn't prevent you from meeting with one. But, you know, you would use your judgment there. Brian, do you want to?
Yeah, I would, if you can start to do things remotely or Skype, any sort of technology that you could potentially use, I would do that. If you know it's at-risk population, we've advised public health to call ahead and, hey, how are you feeling? How are the members of your family feeling? Should this appointment take place in person? If not, what can we do as an alternative?
some offices, everything can be done electronically or via mail.
We have thought about it, and we also, though, have emphasized the flexibility of your management. Now, you know, if it's something that can be done at home, I would encourage it.
Well, my office, it's not necessarily we can't do it at home, but we can do it without our doors open to the public. Most of the majority of our documents come through the mail. We do have title services, companies that drop off, you know, that you drop off as far as people coming in for their vital records. You know, that can all be done through the mail. Genealogy, as far as I'm concerned, I would like to shut that down right now. I think there's no reason for them to do it. Those are emergency situations that they have to find out where grandma was buried. You know, they can do that later, but, you know, some offices don't need the public coming in for them to get what they need.
Okay.
Well, and if I could step in, I think that's where the written continuity of operations plans are important to get sent up. So that, I mean, because otherwise what'll happen is Vince and everybody will get, well, this should shut down here, and this should shut down here, and this should shut down here. We start writing up those plans, then we can give a good plan downward as well, which is how it would work. More importantly, we can message to the employees and the public, this is what's happening, because if we shut down operations, we need to be, you know, messaging to the public in the appropriate format as determined by the administrator and board chair. This is why, this is what we're doing, that kind of thing.
So write up that contingency plan or things like that, and then that, we can hopefully put all those together in one spot and learn from each other. Maybe similar places may want to stop those non-essential things. Mark?
As of right now, like, committees are still in place, county boards, environmental service, county board, general government, et cetera. Those are still gonna be,
Well, at this point, we spoke with the chairman of the board this morning. His initial, he's going to be canceling the committee meetings. So now, if we have something that's urgent that has to be done, then we're going to work through with our corporation council to figure out how we can get things done without getting a lot of people here. But I think pretty confident that most of the committees are going to be postponed or canceled in the near future. I would say the last thing that I'm going to ask you to do when you leave here, wash your hands. So, and thank you for your patience and for your good judgment. I do appreciate everything you're doing. I understand this is not normal or easy, but through your leadership, our folks will come through this just fine. So, thank you.